Have you tried a ketogenic diet either for mental and or physical health reasons and you just haven't been able to get past the keto flu? Well, this video is for you. My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. And a ketogenic diet is one of our most powerful interventions in the treatment of mental health disorders, including serious mental health disorders like schizophrenia, bipolar disorder, and severe recurrent major depression. At the same time, those first few weeks of adjusting to getting into ketosis can be challenging both for your body and for your mental health. So symptoms of the keto flu can include things like irritability, insomnia, fatigue, dizziness, muscle cramps, headache, among others. This usually goes away within the first 2 to 3 weeks. Now, at the same time, it can take multiple weeks to even a couple months to be fully fat adapted, and your body will get more and more efficient at this as time goes on. But it's those first few weeks that are the hardest. So here are some recommendations. 1, don't try to embark on a ketogenic diet when you're already in a stressful situation. Any additional stressors on your body during this time are going to make your symptoms worse. Along those lines, take it easy with regard to exercise. You can do some gentle walks, maybe some yoga, but this is not the time to be training for a marathon or trying to hit your PRs with your weightlifting. Once you start feeling better, you can slowly start reintegrating exercise into your routine. Also, prioritizing sleep. Again, if you're deprived of sleep, this is going to increase the stress on your body, increase your cortisol levels, and this is going to make that adaptation phase even more challenging. So this may mean limiting caffeine, avoiding napping during the day, and saying no to things that might end up keeping you up at night. It's also incredibly important to hydrate. And along with that water, it's important to add some additional electrolytes. So the ones that are most important are probably sodium, potassium, and magnesium. So you can, of course, get electrolyte supplements that you can put into your water. Now, if they're flavored or sweetened, make sure that you're getting one with a sweetener that is keto friendly. So this could include things like stevia, monk fruit, allulose, and erythritol. But these can certainly be a little pricey. So you can also just add salt to your water. Salt is going to give you sodium and chloride. But if you add something like Morton's light salt, it's going to be a mixture of sodium, chloride, and potassium. Of course, you'd have to add magnesium in with another supplement, but this is generally pretty cheap. I do recommend magnesium glycinate if you're going to supplement, because this could help with your sleep and any anxiety issues that are going on as well. There may be other medical conditions or medications that you're taking that may also affect this period. So, for example, if you have diabetes or high blood pressure, your blood sugar and your blood pressure may decrease pretty quickly. And so it's possible those medications may be adjusted. So it's really important that you're working with a medical and mental health provider if you're starting a ketogenic diet and you have pre-existing conditions. And if you're using this diet for mental health, there are additional risks like increased irritability, worsening depression, and even the risk of hypomania during this period. So working with your mental health provider, having your families partner with you in this process so they can keep an eye on you and let you and or your mental health provider know if there's any concerns. And often having an emergency medication like a sleep aid or as needed medications for anxiety can be really helpful during this phase. Usually these symptoms are self-limited, but of course they can be disruptive, and it's important that someone is monitoring and supporting you during this process. If you have any questions about this or tips that made it easier for you while you were embarking on a ketogenic diet, feel free to share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.